I do see the record button.
Okay. Well, you two can talk for just a second while I make sure it's starting. It says 3 minutes.
Family is calling slightly hysterical because I'm about to be hit by a storm and my family already.
I'm getting the same thing, all kinds of Facebook messages. Are you okay? Yes, we're good. We've been through this before. It's not even a 1 now.
Fine.
Okay. See under live. Still not live yet. Didn't take this long to go, maybe because it's scheduled, but it's 3 minutes after. Let's see it.
I just saw a refresh on the back end stuff.
Okay. If anybody's out there, let us know if you can see us. Hello. Don't see it yet. Oh, just refreshed. Let's see. Still says preparing.
Yeah, and I'm seeing something on the back end when I clicked from the page. Let me see what it was actually called. I clicked on, there's a link that says broadcaster only, edit your details. When I clicked on that, it takes me over to another page that says waiting for live video on the top.
Oh, right here. It says, okay, I got to put it in there. Oh, sorry. Here we go.
You have to tell Facebook that it's Zoom or something.
Yes, yes. I have to type it in.
Yeah, I've done this with Latin American groups, but there's some tech person that like does it all. Because yeah.
Okay.
It says it's now streaming.
Okay. It says live now on. Yes, I see it. Yay. Okay. Now, the only thing
I'm doing the right thing because I'm looking at the post and it says going live soon.
Nope, it's just went. Okay, everybody's asking. It's online now. Hello, everybody. Okay, sorry, technical issues. This is our first time doing this, so we're trying to figure it all out. So I appreciate your patience. Hopefully some people, we've got 3 people on there, so people are starting to log in. Yes, looking good. I see Lynn's online. Thank you, thank you. Good job. All right, we're there.
Yeah.
Okay. Now people are coming on. Yay. Hey, and I do IT for a living. You think I'd know how to do all this?
Just be glad I'm not doing it.
Yeah, this has all developed at such just a blindingly fast rate in the last few months.
It's crazy. It's crazy how it's doing it. So this is really my first one broadcasting and hosting. We did a Zoom one last, no, actually September was our last one that we did. And that was covering genetics. So we're excited about this. I see a lot of people hopping on now. We've got 7. So we'll give it a couple more minutes here as people are, there we go, more people. Welcome, welcome. We're going to give it a minute here for more people to jump on before we start our introductions. Welcome. It's interesting because there's a lag between what we're doing on Zoom and how I'm seeing it on Facebook, but yeah, it's going. Hey, Bruce, Gina. Yes, I see people. Yay. I see people. That
How
could be
long
a
have you been
scary
seeing these?
thing. That could be a scary thing. Okay, everybody's hopping on. Minimize that. Doing great. We're recording. Hi, everybody. Oh, we have 14 people. We're getting there.
16.
Yay. Hi, guys. Hi, Patricia. Yeah. All our dog people. Yes, yes, yes. Awesome. I'm excited. This is pretty cool.
It is.
We are streaming live on Facebook, so we are being able to reach people everywhere, worldwide, actually, if we wanted to. I don't know. We do have a few Boykins I know of that are like in the UK. I'm not sure if any more have been shipped around the world. I think at one time, I know Bob Makla may have shipped one over to an Army family overseas, but okay. Well, and there's my girl, Miss Taylor. Yes. Okay, everyone. I think we're getting a good group. Hey there. Okay. So we have about 20. We'll let people hop on. So welcome, everyone. Please bear with us. This is only our second webinar for IVDD and Boykin Spaniel. The first one was actually hosted by the Southern Boykin Spaniel Club, which I am also a president of. And so we're doing this on Facebook live streaming so that we can have a greater audience, and it makes it free. And hopefully it will get the word out a little bit more. It'll be able to save it on Facebook for us so that you can see it over and over again. Plus, we will be recording this and put it up on our website as well. And speaking of our website, it just launched this week. So we have boykinivdd.com, and that is a wonderful resource. Even if you don't have a Boykin Spaniel, we've pulled information from all different sites, universities, different animal clinics that specialize in neurology, and we've pulled that all together. We also have a very special section about stories, and it's many of our Boykin group that have been through this journey of having herniation issues with their dogs, and some that have had happy endings and some not so happy, but we are so happy that they've been able to share through their pain in hopes of helping other families learn about what the signs are and how you can help your dog and be its best advocate and try and get it in a way that it will recover as quickly as possible from this devastating injury. So we've got about 25 people starting, so we'll go ahead and start with the introductions. So my cohort in crime, and I don't know if she's on this side or that side on Facebook, but point out there, Deborah, yeah. Ms. Deborah Jones. She has helped me greatly in this process. My dog herniated 5 discs 6 years ago, and her dog Noodle also had a tragic injury, and it was very tragic because unfortunately he did not make it. But Deborah has been wonderful in helping share her story. She had a big multi-issue layout in the Boykin Spaniel Society magazine about her story, and we've also featured that on our website. So if you did not get a magazine, you can read her story on our website. But Deborah, you've been awesome to help me get all the content pulled together for all this.
Happy to help.
So, yeah, so she's going to help me tonight. So if you guys have some questions, we sent to our guest of honor a whole page full of questions. So we hope she will incorporate a lot of that into her presentation tonight. We are very happy to present Dr. Sheila Carrera-Justiz, and she is out of the University of Florida, which is very close to me. And she has helped one of our friends here in town, Deborah, and her dog Chewy. And so I'm very happy that she has been able to spend some time, especially tonight when Florida is getting hit with a hurricane, or it's a tropical storm now. But we hope we don't have any internet issues while we're doing this, because it's quite stormy outside. But Dr. Sheila, thank you so much for doing this for us. I reached out to her and she jumped right on the bandwagon and said, I would love to share this information. She sees the injuries from the moment they walk in the door all the way through a rehab process. So she's going to be able to give you a lot of information tonight. So I guess without further ado, we will hand it over to the doctor. And when we're done, we'll try and answer some of your questions and hopefully enlighten you a lot on the injury and how we can best help to save your dogs and help them to live a long and healthy life like my Kona has done for the last 6 years. So without further ado, let's see if I can make you.
So I'm going to share my screen.
Okay.
Thank you all for joining this evening. I'm going to share my screen because I have a PowerPoint mostly to keep me on track and remember to tell you guys the important high points that I feel like, honestly, what owners should know about disc disease in dogs. So I'm a veterinarian. I've been a veterinarian for longer than I care to admit now. And I am a diplomat of the American College of Veterinary Internal Medicine. So that's what the DACVIM means. And the American College of Veterinary Internal Medicine is a big umbrella group that has a couple of specialties within it. And I'm a neurologist, which is the parentheses neurology. And I've been at the University of Florida for 6 years now. I spent 4 years in private practice as a neurologist, actually on the west side of Los Angeles, before I came back to academia. So I've seen the real world. I haven't lived in the ivory tower my entire career. And I trained across the US. So I have a bit of different background. What am I gonna try to present to you guys with this? This is the basics. So what is IVDD? Who gets it? What does it look like? What are your treatment options? When is it an emergency? Because it's not always an emergency. And what's the prognosis? And I've got just a very teeny bit on physical therapy, and I'll explain why. And I can talk a lot more, especially with your questions about basically how we handle physical therapy and rehab. So basic anatomy. We as humans stand upright. All of my patients have 4 legs and they use all 4 legs. So they look more like this: dog, cat, horse, sheep, goat, otter. It doesn't really matter. And what I care about is the brain, which we're not talking about tonight, and then the vertebral column, the spine. And you have an intervertebral disc anywhere from the second cervical vertebra in the neck, basically actually into the tail. And so at every space, you have the potential to have problems with disc disease. What does it look like a little bit closer? So this is a dog spine in particular, and you can see the white is bones, and then what they have here in pink is the disc. And the good part about this is that the discs are made of cartilage, and they're supposed to basically be shock absorbers in between the vertebra along the spine. And then in this space above the vertebral bodies, you've got almost like, you can think of it like a tube, a PVC pipe, is where the spinal cord runs. Because your spinal cord, just like your brain, has to be really well protected. This is another image of dog, actually, vertebral bodies. And this is 2 different vertebral bodies with a disc in between, and then the space here where the spinal cord should go. And discs are kind of like a jelly donut. They have a firm fibrous outside and they have a soft, cushy inside. And they're made of different kinds of cartilage and collagen. And the center of them in particular should be really sort of gooey, viscous, almost liquid cartilage. And then the outside is really firm and fibrous because it's trying to keep the inside in place. And that's what these should look like normally. As we age, they all degenerate. We all know about this a little bit ourselves. And there are different, some people have bad backs, some people have bad knees. There are certain breeds that are definitely more predisposed to trouble with disc disease. I'm going to talk a little bit more about it. What does intervertebral disc disease mean? it means that there is something wrong with the intervertebral disc. It has degenerated, whether it's because it's abnormal for genetic reasons, whether it's just degenerated with age, it's worn down, it doesn't matter. It's a very big, very broad umbrella term. What we try to talk about a little bit more, is it intervertebral disc protrusion or extrusion? Because you can have intervertebral disc disease, but not actually have a clinical problem, which means you might have an old disc, but it's not doing anything to your spinal cord or your nerves. So it's not really an issue. You would simply notice it if you did some kind of an imaging study. Intervertebral disc disease is, for good or for bad, used interchangeably with intervertebral disc protrusion, extrusion, a slip disc, a herniated disc, a protruded disc. They all basically mean the same thing. They mean that the disc, for whatever reason, has moved out of the place that it should be and is now compressing either the nerves once they've exited the spinal cord or the spinal cord itself. And that's extremely inconvenient because you need your spinal cord to move and you need your nerves to not be squashed so that you're not in constant pain. So there's a bunch more information out there in dogs in particular when it comes to disc disease. And this is, I openly admit, a cartoon I stole off the internet. You'll read a lot of stuff about two types of IVDD. Type 1 IVDD, and these are Hansen's classifications. Dr. Hansen was actually a veterinary pathologist like 100 years ago, maybe not 100, maybe like 60. But he was a pathologist. And so he described these things when he looked at the discs out under a microscope. And basically, type 1 is what happens more classically in a dachshund. And dachshunds are the poster child for acute disc extrusion, so the very sudden slipping a disc. Dachshunds generally represent over 50% of the population in studies that are published on acute disc extrusions. So dachshunds, I just had to put my 16-year-old dachshund to sleep because she was so senile she didn't recognize me. They are the poster child. They're basically the reason I get woken up in the middle of the night. The other type of disc disease that we see is what's called type 2, and it's this other image over here. And it's more of a bulge of the outside, while the type 1 is a very sudden extrusion of the inside. And so my classic description to students and clients about an acute extrusion or a suddenly slipped disc is that you step on a jelly donut. And if you step on a jelly donut, the inside comes squirting out, and it has to go somewhere, and it goes upward and into the spinal canal, and that's what ends up compressing the spinal cord. And if this happens really rapidly, you're going to very rapidly start having some kind of abnormality. Type 2s tend to happen a bit more slowly because it's not really the inside that pushes out. It's actually the outer fibrous thick rim that slowly bulges. And this typically happens over months to years. And the poster child for this is the middle-aged to older German Shepherd, or actually the middle-aged to older Doberman. The German Shepherds tend to have this happen in their back, and the Dobermans tend to have this happen in their neck. So it's really the difference between an extrusion, where you have the sudden squirting out of the nucleus, the inside, or a protrusion, which is a slow bulge of the annulus, which is the ring, the outside of it. And let's see, trying to see, there we go. So who can actually get IVDD? The short answer is anyone. I have done most spinal surgery in dogs, but I've also cut cats for slip discs. I have also done surgery for disc disease on a sea otter. This can happen, it's reported in pigs. It can happen truthfully in any species that has a disc. Dogs tend to by far and away be the most commonly affected. Within the group of type 1 or acute extrusions, the basically emergent cases, these are what are usually classified as chondrodystrophoid dogs. In layman's terms, if you are chondrodystrophoid, it means your cartilage isn't quite normal. And to a dog, this translates to the fact that you probably have short, stumpy legs and or a smushy face. You can think about a dachshund as the poster child. The dachshund is a long-nosed, long-bodied dog, but the legs are significantly shorter than what they should be. French bulldogs, English bulldogs, Bostons, pugs, anything like that, Lhasas, Shih Tzus, and actually Chihuahuas and Cavalier King Charles Spaniels are also considered chondrodystrophoid. So it's more than just the super smushy face or the really short legs. There's a bigger category of this. We also honestly even see the occasional pit bull or Labrador or random other dog that can suddenly extrude a disc. These are the usual suspects, but anybody can do it. In the last couple of years, and I know you guys have heard about this, we finally have learned the genetic reason behind chondrodystrophoidism. And that's the FGF4 retrogene. A group out of Davis found this. We do not know what the implication of this is. We don't know yet what it means. If you have the mutation, does that mean you will blow a disc? If you have one copy versus two copies, that part of it is not yet well understood. The other concern that you would have about this, gene is that if you try to eliminate it, you're probably very much going to affect the way that the breed would look, because the reason that, dogs look a particular way they do has to do with how their cartilage and bone develop. And if you all of a sudden change this gene, you're going to change the physical attributes of the animal. And people love their dachshunds. So we don't really know what to do with that yet. When it comes to non-chondrodystrophoid dogs, like I said, we do see not smushy face, not stumpy legged dogs get IVDD. It's usually the more chronic kind, like the German Shepherd. But I have also done surgery on German Shepherds for what are true acute extrusions. So anything is possible. You always have to keep an open mind. IVDD is the most common condition that affects the dog spine, period, hands down. There's a whole bunch of other things that can do it, that can make you have other issues, but disc disease is by far and away the most common. So what does IVDD look like? And I'm going to go back to a little bit of anatomy, and I've got, a skeleton of a dog over here. So I mentioned earlier that disc disease can occur anywhere that you have a disc. Most commonly, however, we see it happen in basically two locations. One is in the mid-back, and I have listed T3 to L3, which means third thoracic to third lumbar. It's actually even narrower than that. What's reported is that most dogs, if they're going to slip a disc in their back, it's actually from about T10 to L3, so 10th thoracic. So the last 3 to 4 ribs, basically, and the first couple of lumbar vertebra. It can also happen in the neck, anywhere from C2 down to C7. Certain breeds, we tend to see more do one than the other. Beagles are sort of notorious for herniating discs in their neck, but they'll occasionally blow one in their back. Dachshunds will do both because they're dachshunds. Pomeranians tend to do it in their neck more so than their back. Yorkies will actually do a bit of both. To us, it doesn't really matter. It's functionally the same thing. Funny enough, it doesn't occur usually within the sacrum, which are the 3 vertebrae that are fused in the pelvis, because you don't have discs there. It is possible that it could happen in the tail, because you do have some discs in the tail. And funny enough, there's a report of course, a dachshund who blew a disc in its tail. The poor dog was normal, but screaming in pain and miserable, and had surgery to remove the disc and then felt better. So it definitely is something, it can happen anywhere. It just has these very common locations of the neck and sort of the mid-back. What does it look like clinically if you have IVDD? So from a very basic perspective, because we're affecting the spinal cord, and the spinal cord in the neck has nerves that go to all 4 legs. So if you have a problem with a disc in the neck, you are generally going to have all 4 legs affected. Not always symmetrically. Sometimes the back is worse than the front. Sometimes the front is worse than the back, whatever. All 4 legs are affected. If it's something that happens in the mid-back, it's only going to affect the back legs and the tail, and the front end is actually going to be completely normal. And that's a crash course in neurolocalization when it comes to the spinal cord. The more important part of IVDD and what does it look like actually is referring to severity. And I know you guys have a little bit of information about grades of IVDD. I avoid talking about grades because there are multiple different grading schemes out there. And funny enough, the two most commonly used grading schemes actually have an opposite numbering system. And that can create a lot of confusion. And the truth of the matter is that the number doesn't matter, because really the grading scales exist for publication purposes, for research. What you care about is the description. Who cares what number you stick to it? It's what can you actually do? And so basically we look at, are you painful but neurologically normal? Are you able to walk, but you actually have some incoordination and some lack of awareness of where your feet are in space? That is known as proprioception. Proprioception is the reason that you can feed yourself in the dark in the movie theater when we used to be able to go to the movies. It's the reason that you don't, you go to take a drink of water and you don't pour it all over yourself. Proprioception is a very sensitive and a very fine sensory function that's carried by the spinal cord. And when you have any kind of injury, it is the first thing to go. And what that looks like is scuffing and knuckling, and even dragging of the feet. Incoordination, which is known as ataxia, often comes next. And that is where you have sort of a drunken gait or a stagger. And you can tell that they're very irregular in foot placement and stride and gait. The next step down from this would be if you have an animal that is unable to walk. And so with a quadruped, with a four-legged animal, they have to be able to get their bum up off the ground and take at least a few steps to be considered ambulatory. But you can be non-ambulatory, not able to walk, and still move your legs. And these guys you can see pretty obviously, because they're trying to get their feet under them, they're trying to move them, or if you hold them up, you can see them actually move their feet forward, but they're weak enough that they're just not strong enough to hold themselves up and do this on their own. Next step down is that they are not able to walk at all. They are truly paralyzed. They have no voluntary function, but they can still feel their feet. So they still have pain perception, which is the phrase that's used. And this is really the important cutoff. And then the worst case scenario is that you have an animal that is completely paralyzed and cannot feel its feet or tail. So that scenario, this is functionally what's considered a functional transection of the spinal cord. It doesn't mean your spinal cord is cut in half. It means it functionally is, because no signal is making it down to your legs and no signal is making it up. And so when we do our exam to evaluate an animal, the first thing we check for is, can they walk? So we do everything we can to coax them and tease them and try to get them up and move. If they can't, then we support them. We hold them up, see how much they can move their legs and see if they can voluntarily move their legs. Great. Because if they can do that, we stop there. If they can't move their legs at all, then the next thing we have to do is pinch them. And here's where it's really important. You have to pinch their feet and their tail to the point that we have to be able to tell if they can consciously feel this or not. Because most of you guys have grabbed your dog's paws and you can appreciate that they pull their legs away. That's a reflex. That is unconscious. They just don't want their feet touched. It's a normal reaction, but it doesn't make it all the way upstairs. With animals that we think are truly paralyzed, that we don't see any voluntary movement, we have to pinch their toes until we get either a cry, they try to bite us, they turn around and look at us, they start licking you, something that tells you that they can actually feel that you are pinching their toes, and please stop that. I don't like you doing that to you. Because that tells us that the spinal cord basically is still working. So how do we diagnose that it's IVDD? Because what I just described to you, all of these things actually just tell me that there's a problem with the spinal cord. They are not unique to IVDD. This is one of the difficulties of neurology, is that our exam tells us where the problem is, but not what the problem is. We can be suspicious of what the problem is. I told you earlier, IVDD is the most common condition affecting the dog spine. So that's usually at the top of the list. But there's some breeds that disc disease is very uncommon. And so then we have other things higher up. So how do we diagnose disc disease? Radiographs, x-rays are frankly kind of useless. They're not helpful at all. And in my opinion, for the dog that you really suspect a disc, they're honestly almost a waste of money, because what you see with an x-ray is bone. You don't see cartilage. You don't see the spinal cord. Your spinal cord is made of fat. And so you can't make any kind of a diagnosis about the spinal cord and the discs with an X-ray. What you need is either a CT or an MRI. And the problem, the scenario here and why I have the slide set up this way is that when you do a CT or an MRI, you have to choose what part of the spine you're actually going to image. If you've ever had an MRI, if you have it of your head, you know they put your head inside of a funny box. If you're having it of your knee, they put it inside of a coil. MRI can't just MR the whole body. That would actually take hours and hours and hours. And even with CT, you have to know where to focus and where to look. And so the big thing that you actually need if you're worried about a neurological problem is a neurological examination to be able to neurolocalize, figure out where along the spinal cord the problem is. And usually the best people to do that are either going to be a surgeon or a neurologist, because this is something that's going to be relatively, honestly, routine to both of those groups. And then based on the exam and based on what they've found and what they think of the breed of the dog, they'll recommend either a CT scan or an MRI. And you can do CTs by themselves. You can do them with what's called a myelogram, which is where you inject contrast in the space around the spinal cord. The reason for that, so if you're a dachshund, dachshunds are very chondrodystrophoid, and they're notorious when they degenerate their discs. The discs actually mineralize. They have calcium in them, which you totally should not have. And so the advantage of that is that if a dachshund comes into me at night, emergently paralyzed, I usually throw him in the CT scan, and CT is very, very, very sensitive to mineral. And so a CT scan can pick up the calcium in the disc that the dachshund has and that he's slipped. I almost never have to do a myelogram, and I don't usually have to do an MRI. That's important because CT is faster and cheaper than MRI. And in the middle of the night, when I am looking at the potential for surgery, this is actually a really good thing. If you either don't have access to MRI, or there's a hurricane and the power goes out and the MRI can't work, all of these things have happened. Myelography is a reasonable thing to do in conjunction with CT. It's actually a beautiful test. But there are some species that some breeds that we just don't want to do this at all, and we go straight to MR. It does depend a little bit on your doctor preference. MRI is considered the gold standard for diagnosis of disc disease, and that's in multiple publications. So I've talked about some specialists. What does it mean to be a specialist? How do you find a specialist? There are a number of things that you can do. One of the things I usually recommend people do is talk to your local veterinarian, your regular veterinarian, and find out who they've worked with, who they like, who they trust, who they've worked with in the past, how responsive have they been, all that kind of thing. That's super important for many reasons. Other things that you can do is that you can look online. So this website, vetspecialists.com, is run by the ACVIM. And so you can find neurologists, internists, oncologists, and cardiologists on this website. And then the ACVS, which is the American College of Veterinary Surgeons, on their website, you can actually search for, basically find a surgeon near me, and find somebody who is basically in your area. Most specialists do not require a referral from their general practitioner. You can just call up and make an appointment, or if they have an emergency service, you can just show up as an emergency and somebody will see you. There's absolutely nothing wrong with getting a second opinion. It's always a completely reasonable thing to do, provided that you're not in a major time crunch. And so these are, two references to go about it. Why do you need a specialist, and why do you need a CT or an MRI? So what it means to be a specialist means that you went through veterinary school, you graduated with your DVM. You then did at least one internship, so 1 year of rotating through all of the services that are important. So medicine, surgery, anesthesia, oncology, emergency, neurology, ophthalmology, cardiology. You basically get a crash course in everything. And then you go on to do a residency, which is a minimum of 3 years in whatever particular specialty it is. So in this case, we're going to talk about small animal surgery or neurology. And in that time, That is all you do. That is all you focus on. You do nothing but that. At the end of a neurology residency, any neurologist honestly should be able to do a spinal surgery for a disc extrusion in the middle of the night with no problems. That's the point of these very, very intensive training programs. Other things to think about in this scenario, when you have an animal that has trouble walking, when a dog basically goes down, disc disease is definitely a common and an important thing to think about, but there are a lot of other things that you could find on your imaging. And you need somebody who is going to be able to not only recognize that it's something else, but also recommend what you should do with it. What are the best treatment plans? What else do we need to do if surgery is not an option? And they have to be able to interpret the CT or MRI that they've done. Ideally, in these scenarios, when we have a dog that's suddenly unable to walk, that's suddenly paralyzed, you usually want to be able to set it up so that if the dog goes to CT or MRI, they have to be under general anesthesia for that. So you want to be prepared that they can just go straight to surgery. You don't want to have to wake the dog up, recover him, and then put him under anesthesia again. We do that sometimes if we are intentionally trying to stage things, but in an emergency situation, time is usually of the essence. And so you want to be able to be efficient and do this all at once and actually address the problem. And so as a specialist, this is what you're trained to do. This is what you've spent years and years training for. So what are treatment options for IVDD? You can do medical management, you can do imaging and surgery, and then I have to include it in there. Humane euthanasia is also an option, and I will talk about why. So medical management includes strict rest, pain control, and anti-inflammatory medications. We recommend medical management when a dog can still walk. So a really good example of when we would offer medical management is a dog who it's the first time and they just suddenly have neck pain or back pain, but they're otherwise totally normal. That dog, we would 100% offer, take your dog home, rest it, and we're going to give you medications to try to control the pain in the meantime. Because in a lot of these scenarios, medical management actually has a really, really, really good chance of controlling the problem and making the dogs better. We will also occasionally recommend medical management in some dogs that are abnormal. Occasionally, if they can't walk, but they can still move their legs. Usually, we don't love to do this, but not everybody can afford surgery. Not everybody can afford to do all the things, or maybe you have other conditions that are not going to allow us to put the dog under anesthesia, what have you. And so it's a reasonable thing to try. We definitely do not recommend medical management when a dog is completely paralyzed, and especially not when they've lost feeling, because those are emergency situations where you need to basically like buck up and make a decision because of the potential complications. So what does medical management mean? Strict cage rest in my world means you are in a crate for 23.5 hours a day. You only go outside to go to the bathroom on a leash, no running, no jumping, no playing, no stairs, no roughhousing. Because the reason for this is if you are dealing with a slip disc, you've got a bunch of shmoo that has just squirted up into the spinal canal and it's compressing the spinal cord. You need the dog to be quiet and calm so that the body can try to scar that material down and actually resorb some of it. And you have a dog if you have a dog who's being crazy and trying to get the squirrel and trying to get the mailman and jumping on and off of furniture, that's not going to happen. Crate rest is the most important part of medical management. The drugs that you give are honestly just a Band-Aid. They're actually not doing anything for the disc. We give drugs for pain control and as an anti-inflammatory. You can give either a non-steroidal anti-inflammatory drug like carprofen or meloxicam or something like that. You guys are probably all familiar with those. You can give steroids. I am not a huge fan. I prefer to use a non-steroidal over a steroid for a bazillion reasons. And the literature supports that. But you can use either. And then something for pain, usually gabapentin, which is a super safe drug that's used for acute and chronic pain. It's real safe in dogs. You can use tramadol. And both of these drugs, if you use them at high doses, have the convenient side effect of causing sedation, which when you're trying to take an active dog and keep him in a crate all day long, sometimes the sedation is convenient. We can also use trazodone or something else if we really have to sedate them. Methocarbamol is Robaxin. I see this used a fair bit. It's honestly, in my opinion, not helpful in the vast majority of cases. Robaxin is a muscle relaxant. It's not actually a pain control drug. It can be helpful in dogs that have disc disease in their neck if they're having really bad muscle spasms. But if you have disc disease in the back, muscle spasms are not a typical component of that. They hurt because the nerve is pinched. And that's where gabapentin and tramadol and an anti-inflammatory are actually much more helpful.
Something like Duramax.
Duramax is Duramax is one of the non-steroidals. It's a giant group of drugs. Usually I tend to prescribe carprofen because I'm familiar with it, honestly. But if I have a dog who has received an anti-inflammatory in the past and tolerated it well, that's always a good drug to choose because you've handled it well. I don't have strong feelings about which anti-inflammatory you choose in that category. So if we move on, if we're thinking about imaging and surgery, if you're thinking about surgery, you need imaging. And the reason for that is that I need to know where to do the surgery. So you have 7 cervical vertebra, you have 13 thoracic vertebra, and 7 lumbar vertebra in the dog. And that's in a normal dog. Sometimes dogs have 6 lumbar, sometimes they have 12 thoracic, sometimes they have only 1 rib on one side. And those things sound silly, but they're actually very important because when I'm going into surgery, I need to be able to count to know where I am. I also need to know if the disc is more on the left or more on the right side because of how we do the surgery. So I need to know what level, so what space, and I need to know what side. And CT or MRI actually can show you that. The surgeries that are done, and these are pretty standard, very typical. If it's a surgery in the neck, the procedure is called a ventral slot. And you actually go from the underside of the neck, which I know sounds scary, but basically you cut skin, you find all of the really important structures in the neck and literally push them out of the way. And then you drill a tiny little hole. And by tiny, I mean 2 to 5 millimeters in length and usually about in width and about 5 to 8 millimeters in length. This is literally like a coin slot. And that's how you access the spinal canal. And then you scoop the disc material out really carefully with tiny instruments. In the back, the procedure is called a hemilaminectomy. It's hemi because it's on one side, it's only half. Laminectomy because what we do is that we drill away very carefully part of the bone that's there that's covering the spinal cord, which is called the lamina. And it's an ectomy because we're actually removing it. And so you drill this window over where the disc is extruded. And then again, with tiny instruments and without touching the spinal cord, you scoop all of this foreign material, which is usually disc and like blood clots. You scoop that all out of the spinal canal. You've probably read something about fenestration. Fenestration means to create a window. And what this procedure is that once you've decompressed the spinal cord, you've done your laminectomy, you then can come and actually make a hole in the side of a disc and try to scoop out some of the inside of the nucleus that's there. And you could do this at the site that you just did surgery. You can also do this at other sites. This is super controversial among neurologists and surgeons because it really hasn't been shown to be solidly effective at reducing the rate of recurrence. And it's not benign. You can have complications with it, and it does extend your anesthesia time. So I don't fenestrate every patient that I take to surgery. I would not fenestrate the 10-year-old German Shepherd. I would not fenestrate the 12-year-old Dachshund. I would fenestrate the 3-year-old Dachshund because if you're 3 years old as a Dachshund and I'm already have you in surgery, I'm afraid I'm going to see you again because you have 10 to 15 years of life. However, if you're 12 and it's the first time you've done it, the odds are just lower that I'm likely to see you again. That is not scientific, and I openly admit that, but we really don't have great data to really say that you definitively should do this. But it's a tool. It's a tool that we have.
So just interrupt real quickly.
Yeah.
So if you have a bulging disc,
Yes.
they're in there, you've done the MRI, you say it's a bulging disc. What would weigh the options between going in and doing the fenestration versus sending them home for medical management?
So I would never take a dog to surgery just for fenestration, because so the problem is fenestration doesn't do anything about something that's already in the canal and compressing the spinal cord. For you to do something about the spinal cord being compressed, you have to do a laminectomy or a ventral slot. I've got to do something to actually address the stuff in the canal. If we have an animal, like you mentioned, your dog had 5 abnormal discs. We see that a lot, God help us. What we have to decide in that scenario is which one or ones of those discs are the problem. Usually there's one disc that's worse than the others. Sometimes there isn't. Sometimes you also, in some of these very acute extrusions, you can have a disc that slips and it squirts out, it extrudes with really high velocity, usually tears a sinus, so there's bleeding, and it just explodes over 2 or 3 spaces. And so in that scenario, you, instead of just opening 1 space, we have to open 2 or 3 and make just a bigger hole. We know we can do that. There is a limit as to how big of an opening we can make in the spine, but it's actually really big. Because what you need to do is decompress the spinal cord wherever you think it's most affected. There is a point of diminishing returns and where more is no longer better. And that's what you spend a residency learning, the subtleties of, yes, that disc is abnormal, but that one's probably old and not causing a problem now. This one is new and it's worse, and this is the one that we need to go after, and messing with that old one might actually cause more harm than good. And those are more subtle distinctions that truthfully, like, you spend 3 years doing nothing but that, figuring out, should I cut it or should I not cut it? Because just because you can definitely doesn't mean you should. And so the last option, which we don't like to talk about, but we're veterinarians, health insurance is very different in animals than it is for humans, and that's humane euthanasia. And the reason that euthanasia is an option, we offer this as an option in a severely affected animal, which usually means an animal that's completely paralyzed, that maybe has lost feeling in its feet. And the reason that it's an option in that scenario is that this is a really serious condition with the potential to permanently affect quality of life and lifestyle for the animal as well as the family. This is a condition that is expensive to treat. And there is the potential for there to be a very intensive recovery period that requires significant care. I've euthanized some dogs because they belong to a 94-year-old person who's wheelchair bound that can't take care of this. And that, unfortunately, that's a very valid reason to consider euthanasia. Other things that we also have to consider are concurrent diseases. We will have dogs that have cancer or have really bad heart disease or Lord knows what else. And they honestly simply cannot undergo anesthesia for these things, because honestly, we'll probably kill them by putting them under anesthesia. And so it's probably better to be able to humanely euthanize them than to make them suffer by undergoing the procedure. So there are a lot of things to consider. You know, what is the care situation at home? What are the long-term goals? You know, there's a lot that goes into this, and you know, we do have a lot of discussion with owners before we make any of these decisions. They're not as simple as I make them out to be. So what are the outcomes? What do we know? What are the statistics for IVDD? The numbers I'm about to give you are for acute disc extrusions. So the very suddenly affected animal who stepped on a jelly donut, blew a disc. This literature also, these numbers apply to predominantly thoracolumbar disease, sorry. So if only the back legs are affected and the front legs are normal. The last big study that came out, and I want to say it was like 2012 maybe, it was like 600 dogs. It was a huge number. And what they found is as long as you can still feel 1 foot or tail, that means you have intact pain perception and you have a better than 96% chance return of function with surgery, which is honestly pretty damn awesome. There's very little that we do that has that kind of a success rate. And this is why it's so important if you can feel or not, because this is a pretty awesome outcome, you know, recovery with surgery. What else? If only the back legs are affected and they have lost feeling, so they have absent pain perception. Numbers get a little fuzzy here, but if you catch it within about 24 hours, you have about a 50-50 shot of them regaining feeling.
Okay, I just want to stop you. I just want everybody to look at that, because that is why we say in our group, or when we're contacting a person that's saying their dog is not walking, that's why I personally stress to people that number right there.
Correct.
This is why
this is so important, and this is how you get a neurologist worked up, is if your animal starts walking funny, take them to be seen. If your animal can't walk, take them to be seen now. Because if you can still feel, if you still have a little bit of motor, you're great. As soon as you lose feeling, you go from 96% to 50%. That's a big drop. In this population, as soon as an animal regains feeling, honestly, they're probably going to be okay. They will eventually get up and probably walk again. Maybe not normal, but they'll be functional. Half of that population will not get better. And so you have a significant risk here of having an animal that is permanently paralyzed. And along with being paralyzed, they're also fecally and urinary incontinent, which means they're going to poop whenever they have to. They're unaware of it. And you will probably have to manually express their bladders because they don't have control of their bladders anymore. And in this scenario, we have very long conversations with the owners to make sure that they understand this. Because the bladder actually often is what becomes a deal breaker for a lot of people, more so than mobility. If an animal has been paralyzed with no feeling for longer than 48 hours, theoretically, you have less than a 20% chance return to function. It's not zero. I have seen animals come back from this point. It's just not great. It's not, those are not good odds, depending upon what you're looking at. So the other concern here is that if you have lost pain perception, regardless of where you are, you're at risk for a condition called myelomalacia.
And we just unfortunately lost a dog in our community because of that, because it was over a holiday weekend. So you were over that 48 hours.
Yep. Well, so holiday weekends to specialists are not a thing because somebody is always on call. And so I'm going to talk to you guys a little bit about that.
Perfect.
Yeah. So what is myelomalacia? Myelomalacia is terrible. I have no other word for it. This is when you have such a severe spinal cord injury. It can be a disc, it can be a stroke, it can be a broken back. It doesn't matter what the injury is. It is when you have an animal that has had such a severe spinal cord injury that they cannot feel their feet and the spinal cord starts to die. The problem with this is we can't predict who will get myelomalacia. We just know that if you're going to get myelomalacia due to disc disease, it usually happens within about a week. And that doesn't include whether you've had surgery or not. Surgery does not prevent myelomalacia. That's the other hard part. There is no treatment for myelomalacia. People have tried everything, all sorts of things, and there is nothing that actually prevents this from occurring. The reason that myelomalacia is so bad is that this will kill a dog. And so as a doctor, if I think an animal has developed myelomalacia, it's a clinical finding. It's their exam, instead of them just being paralyzed, their exam starts to change and they start to lose their reflexes in their back legs. It starts to affect their front legs. And if you let it go long enough, it actually affects their ability to breathe. And so if you do not euthanize these dogs, they will suffocate, they will asphyxiate because they can't breathe, and that's what will actually kill them. And that is absolutely miserable to me. So if we think that an animal now has become malacic, we actually recommend humane euthanasia because there's literally nothing else that we can do about this. It's truly terrible. The good news is that when I gave you guys these numbers of about 50% will improve and about 50% won't, the incidence of myelomalacia due to IVDD, it's approximately 15%. So 1/5 of the 50%. So it's a fraction of a fraction. It's not a high number. That is variable. Some studies have cited as low as 5% myelomalacia. Other studies have cited as high as 25% myelomalacia, but it's approximately 15% of the 50% of dogs that don't get better will develop malacia. There's a recent paper about 2 or 3 years ago that came out that, funny enough, showed that French bulldogs have a higher incidence of myelomalacia than dachshunds. Because we see a lot of both. I get woken up by Frenchies and dachshunds in the middle of the night, and the Frenchies are worse than what we see in the dachshunds. So when is IVDD an emergency? We mentioned a little bit of this already. Things for you to think about. If you notice that your dog is walking funny or a little bit wobbly, call your vet and make an appointment for the next day or two, as long as they're walking and wobbly. If a dog goes down, if they lose the ability to walk, go to your nearest emergency clinic as soon as possible. It might be that your dog can't walk but can still move its legs, and so that's actually pretty good. It might be that your dog is completely paralyzed, and then you need to hustle and actually find a specialist nearby. So this is a good general rule to think about with, you know, any of your patients. What do we know about recurrence rates? Will this happen again if it's happened once? And most of this literature, like I said, is published in little smushy-faced, stumpy-legged dogs. The recurrence of IVDD is published at approximately 20%. What you have to understand about the word recurrence here is that it does not mean that your animal will become paralyzed and need surgery again. It means that these animals had another episode of pain or trouble walking or wobbliness or something like that, but they may have also been managed with, may have been medically managed. They didn't necessarily need surgery. So this is, when I see this most, honestly, it's usually dachshunds. It's usually dachshunds that are the repeat offenders. However, anybody can do it. Big picture things, and I've given you very broad estimates. How much will this cost? When you're going to see a neurologist or a surgeon, the prices are going to vary significantly based on academia versus private practice, based on demographics, so the city that you're in. When I practiced in LA, you bet that was more expensive out there. My friend is a neurologist in Miami. They charge significantly more than we do. Tampa tends to be cheaper than Orlando by a bit. The universities tend to be cheaper than private practices, but that's also quite variable. It will depend a lot on where you are across the country. Usually an exam fee is going to be anywhere from $100 to $300. CT is significantly cheaper than MRI. CT is also much more available. So a lot more people have CTs than MRIs, and it's going to vary depending upon where you are. So will the cost of surgery, hospitalization, rehab, and everything like that. So you might be looking at anywhere from $4,000 to $12,000. Miami, I know they routinely, it's like 8 to 10 grand easily for a back. I just spoke to one of the neurologists in the Tampa area, and they quote about 6 to 65 on emergency. We're probably here at UF, we're about 45 to 55 if we do a CT and it's a dachshund and it's a little dog that can still feel. It's a little bit cheaper if an animal can still move its legs a little bit, because they tend to be in the hospital a shorter time, versus if you're paralyzed with no pain perception, you're going to be in the hospital a bit longer because we have to manage your bladder and get that to a point that we can send you home. So there's always going to be a bit of a range. So what can I tell you about PT? I will first say I am not certified in canine rehabilitation. I am not certified in acupuncture, because we have a service in the hospital that does all of this. What does physical therapy and all of these other non-traditional things do? PT, what it's been shown to do in the literature that's out there is that it actually helps shorten the time that it takes for an animal to get back up and walk again. It doesn't shorten the total recovery time, because PT doesn't actually help the spinal cord heal. It helps with muscle memory and patterns and strength and range of motion. No, you nosy dog. But it helps shorten the time that these guys actually will get up and walk again. This is more important with a larger dog, and probably a little bit less important with a smaller dog, because who cares if you have to carry your 10-pound dachshund? It's much more of a problem if you have to carry your 80-pound Labrador. And then there's, you know, the spectrum in between. Other non-traditional therapies that are very much worth considering are things like acupuncture, and even hyperbaric oxygen. And these things are variable. There are a lot of people now that are certified in canine acupuncture, because the Chi Institute, which is actually just down the road in Micanopy, does a course on this.
My vet is certified for that, and I fully support acupuncture and cold laser.
Yeah, so
it's done wonders. It's done wonders.
There's literature on both of these things. And so from the like dry scientific side of it, what I can tell you is acupuncture has been shown to have some efficacy in pain control. So we will use acupuncture in dogs that are really painful, that we're having trouble finding the right combination of drugs. Acupuncture can be very, very helpful for that. Not every dog tolerates it. Some dogs are super needle shy or lose their cookies when they go in there. And so if they're stressed by it, it is not worth continuing to try it. If they tolerate it, it's worth trying 2 or 3 sessions and see if acupuncture helps. Cold laser, there isn't any data specifically for neuro stuff. It definitely helps with wound healing and more superficial things. Most of the lasers do not penetrate bone, so they're not going to do anything for the spinal cord itself, but they can help with the more superficial and surrounding tissues. There is, interestingly, and this for you guys with the breed of dog that you have, something to consider, there should be a paper coming out soon actually looking at penetration of laser based on coat and skin color. Because for laser to work, you have to shave the hair off the dog, for one. And what they've actually found is that how much the laser penetrates is very dependent upon the pigment in the skin. And so if you have an area of very thin skin, clearly it's going to get through. What they showed is that in white-skinned dogs, the laser penetrates very well, and like yellow dogs. But by the time you get to dogs that have brown to black skin, the lasers don't penetrate, and it may actually not even be worthwhile doing it. That paper hasn't been published yet. That was research that was done by actually our integrative medicine service, which I thought was fascinating. And it should be coming out hopefully at some point in the near future. You can search, there is a specialty that is sports medicine and rehabilitation. That's another group. That's one of the specialties. There is also, I'm not great with the abbreviation, there is a canine rehabilitation certificate as well. And there are websites that you can actually search for a veterinarian who is certified in canine rehab. You can search for veterinarians that are certified in canine acupuncture, and find somebody near you, because it's really, really common now. Almost every veterinary practice has at least one person now that can do acupuncture, which is awesome. And acupuncture can be helpful for all sorts of things. I have a old 80-pound pitty mix who has horrible knees, and acupuncture is really helpful for him and makes him feel better. And we recommend it, like I said, we recommend physical therapy and physical therapy and rehab for a lot of our patients when they are in hospital, because it helps them get up sooner. And if they get up sooner, it means I can send them home sooner, especially the larger they are. So those are really important things for me to consider. Most rehab people will also, if you go in for a consultation, for an appointment, even if you are 2-3 hours away, you can't go back regularly, you can also make that very clear to them and say, hey, can you give me an at-home regime of things for me to do for my animal? And maybe, I'm sorry, someone's trying to call me. You can ask them for an at-home regime because you can't go in 2 or 3 times a week. But with that plan, you can say, hey, I can come in once a month or once every month and a half, and I will do these exercises at home with more frequency. And most of those groups are actually pretty used to doing that. And those are very, very reasonable things for you to ask. So that's a boatload of information. I will take any questions that you guys may have.
Doctor, can you speak to anything people can do to help prevent whether it's weight management, supplements, any of that stuff?
Yeah, that's a great question. So there is no supplement. There is nothing activity-wise, honestly, that you can do to prevent this from happening. Truthfully, if a dog is going to blow a disc, they're going to blow a disc. A certain activity might, for lack of a better word, push them over the edge. You know, some people are like, oh, he jumped off the couch and this happened. The dog was probably going to blow a disc anyway. Jumping off the couch was simply the straw that broke the camel's back. That was the last thing to push him over the edge. I have done surgery on, forgive me, fat dachshunds who do nothing but sit in their owner's lap, and they still did this. So there isn't something that is definitively going to make it happen. They usually have a predisposition for it. When it comes to supplements, there is no supplement has been shown as of yet to really do absolutely anything. Your comment about weight is very interesting, because what we know is that being overweight or being overconditioned doesn't actually predispose you to having a problem. What it does do, however, is markedly prolong the recovery. There was a really interesting abstract I read a couple of years ago, that showed that if you were, so in dogs, we use this 1 out of 9 body condition scale. If you are a 5 out of 9, which is ideal, actually a 4 out of 9, and you are down, unable to walk from disc disease, are a 4 out of 9, you should be up and moving within about 2 weeks of surgery. However, if you are a 9 out of 9, which means that you are approximately the shape of an ottoman, those dogs can take up to 3 months to get up and walk again.
Goodness.
Exactly. So having a dog who is lean, who is actually in good body condition, is really important for recovery, not necessarily for the disease. Where it is more important, because usually we're dealing with middle-aged to older dogs, it's definitely been shown that keeping an animal lean is significantly better for arthritis and for mobility. And the ideal situation with a dog is that you should be able to very easily feel their ribs, but not necessarily see them. If you look down at a dog, they should have a waist that tucks in. Granted, that varies a little bit with conformation. And in fluffy dogs, you definitely have to put your hands on them to appreciate, are they fluffy and curly or are they actually fat? But yeah, you want to easily be able to feel their ribs through their coat and not feel them. And that's the ideal body condition.
Especially, I would think, with Boykins, they are notoriously a hunting dog. So we wondered if that core body strength as well, since most of these injuries seem to happen, as you said, in the younger dogs. We've seen as young as 3 and as old, I think, as 7 or 8. And we wondered if having a dog with a better, not just weight, but the core strength.
It's interesting. We don't have any literature on that, because funny enough, you know, dachshunds theoretically are terriers, or they used to be at some point. You know, you would think we see dogs as young as 1 or 2 and as old as 14 and 15. So it is something that it can happen at any age. The younger they are when it happens, the more I worry that they have the potential to do it again. You know, just because you have that much time in front of you. There isn't any literature in particular yet looking at, you know, strength or muscle mass or anything like that. There's a paper that just came out that's looking at proportions of muscle mass in different breeds and in relation to the spine. But how much of that just has to do with conformation of the dog? We don't really know yet. What's interesting is that most of the dogs, really what's more important, I think, is that most of the dogs that we see this in tend to be chondrodystrophoid. But anybody, like I said, I've taken Labradors to emergency surgery for disc disease to, you know, try to scoop stuff out, and pit bulls randomly, and German Shepherds and all sorts of things, even a Doberman. So anybody can do it. We don't have other good factors. People have tried to look at all sorts of things, and the only thing we really keep coming back to is simply breed. That there is a predisposition, and we know that now that the FGF4 retrogene is probably going to play a significant part in that. We don't know what role yet, because it's got to be something that's multifactorial, because you will meet breeders that, there are some lines of dachshunds that simply don't have a problem with discs. We know there's a significantly lower incidence of disc disease in the standard dachshund than in the miniature dachshund. And so what's the difference there, aside from, 15 to 20 pounds? There's got to be something else that we still haven't figured out.
Right, because I think that what we're finding with our study, that there's a 50% allele rate right now for that gene.
Yeah, and that
So-
it probably plays a lot into what the Boykin looks like.
Mhm.
And it's hard because we don't know what that is. It's a really good example of genetics and manipulation is the Cavalier King Charles. Cavies, bless their hearts, they bred them to look the way that they do. And as they've done that, they have inadvertently bred significant skull malformations that cause spinal cord problems. And then they also have these horrible heart problems. It's real bad. And so the Cavi Club in the UK actually was a great model. They did an excellent job of getting all of the Cavi people together. And because the heart disease doesn't become a problem until they're like 8, 9, 10. So they're significantly older and they've already been bred. The neuro stuff becomes a problem usually earlier. But what they've done with the Cavies is that they found a neurologist, they got cardiologists involved. And what they did is they started screening all of the dogs. They realized that if they only bred the normal dogs, they would create a genetic bottleneck and destroy the breed. So they created a grading scheme. And what they decided to do is only breed normal and minimally affected dogs and just not breed the severely affected dogs. And so they've actually started reducing the severity of both of the heart disease and the neuro diseases in the dog. And the American clubs have adopted this too. This effort has taken years. This has been going on for 20 years, but they've done an awesome job of it. And it's actually a really good sort of plan to look at.
Yeah, I'm hoping that we're nipping this in the bud, and especially getting the word out with these webinars and with our website to try and get the attention and see if we can not destroy the breed and do proper breeding, but also if there's another environmental factor causing the issues, that we're aware of it.
Yeah.
I've got a couple questions here too. Okay, so Gina wanted to know, why wouldn't a supplement that strengthens cartilage be beneficial?
There just is no data. It's also, the other thing is that most of the cartilage supplements out there are geared at the cartilage in your joints, like your knees and your elbows, and the cartilage that's in discs is different. And so they're usually not the same, but there is literally zero data out there on it. It's not going to hurt. I just can't tell you that it's going to help.
Okay. And what about leashes and collars, using harnesses versus a collar when you're walking?
Yeah. So if you have a dog who has ever had neck problems, we recommend never using a neck collar. They can wear a collar with an ID tag, but you should wear a chest harness. If they have back problems, it doesn't matter. Use whatever you want. If you've had neck problems before, you don't want a leash and all of that sort of torque and pressure on the neck, because that could definitely make something worse.
Okay. So I know about this dog. We're all near and dear to JJ. So his owner is asking, now JJ is a Boykin that was medically managed for almost 2 years, and then did finally have an episode. She said, if JJ herniated and lost pain and reflex, essentially being paralyzed, but had the hemilumpectomy, I'm not good at that. Is he still in the 50% for eventually walking completely on his own? We are doing therapy, but today he was a little more ataxic with a little worse CP deficits today than last week. We are 8 weeks out from surgery. And when he does try to walk, he's still extremely wobbly.
So if he's walking, you're already doing well. The hard part is so here's something to think about with the spinal cord. It's super fidgety, it's super sensitive. And so if you were medically managed for 2 years before you had surgery, that means you had 2 years of spinal cord injury before you finally went to surgery. The longer a spinal cord is compressed, the more likely you are to have permanent damage. And one of the struggles that we have in the emergency situation is that there is no way, even on the human side, there is no way to tell how much permanent spinal cord injury there is. All I can give you are the numbers. Yes, you will improve, or no, you won't, but I can't tell you how much you'll improve. You know, the vast majority of my patients go back to walking. How well? That varies. Some of them walk like they've had a 6-pack of beer every day. Some of them, honestly, I see them a month out and I can't even tell they had surgery because they look so good. They just have a funny haircut. So it is very variable.
Well, you know, my Kona, it's 6 years now since he had his surgery, and he still has a gimp. But
right. And that's,
you know, we just restricted what he used to hunt all the time. He doesn't now.
Right.
And we just call him Gimpy. And
and that's perfect. And usually we recommend, if a dog has had disc surgery, we usually recommend that they can go back to a relatively normal lifestyle. We don't want them doing crazy explosive things. So I would probably recommend a dog not go back to agility. I would probably recommend that they not hunt again. Just because it's not the average walking around, running around. It's really explosive activities that are what put a lot of force on different parts of the spine. And so those are the things that you're trying to avoid, because that's what can put that last bit of pressure on that abnormal disc and make it hurt.
so let's go back to myelomalacia. I'm really trying to get the word out about that. What I keep saying there's a group of us that now I call them dearly the IVDD warriors in our Boykin group, because there's about 40 of us that have been through it that I know of, and we're all kind of chatting together and talking. And what I found fairly consistently, which is a little unnerving, is that your regular vet is not having a sense of urgency as much as, right. And that really kind of scares me. So when I'm trying to talk to somebody that's reaching out, because I've been through it. So we put on our website, you know, I know you talked about the grading, and again, we don't care about the numbers. Like you said, what we care about is what's happening to your dog.
Correct.
So, you know, and then the time frame of being seen by a specialist, because I really have been seeing where a vet may prolong it. And then a couple of times I've seen this year where it's been prolonged to the point where it may be too far.
Correct.
And the dog has a hard time. I specifically speak of Raylan, who right now is on like 8 or 9 months now. He had, it was over a long weekend, and his vets said, you know, and his dog was not walking. Okay. So he was presented with no rear legs, and the vet wanted to just say, in a week, we'll have a neurosurgeon available in a week. And when I heard about it within 48 hours, I was calling, and I said, you know, you've got to try and get that dog in. Well, he did. They went immediately into surgery. What's unfortunate is that at that point, he then had 2 back-to-back episodes within 48 hours in the care of the neurosurgeon, because he had waited so long.
Yep.
So, you know, I want you, if you could kind of just elaborate again on the timeliness.
Yeah. So what you're describing is unfortunately, it's a really hard scenario. So I do a lot of CE lectures. I lecture to regular veterinarians. I go to big national meetings to try to teach people and to teach veterinarians what you should do. When do you refer? When's it an emergency? When's it not? The hard part is that the people that come to those meetings and that go to those lectures are the ones that want to learn. The ones that don't go think they know it already, or don't want to learn. And the literature has changed, and the profession has changed a lot in 15, 20 years. And fortunately, more and more, the younger vets are getting better and better at recognizing you should refer this, and this should just go, versus now let's wait on it and we'll just see what happens. And there are more and more practices now that are 24/7. Your emergency clinic is aware of this. The emergency clinic knows who to refer it to and will find you the closest person that can do this. So it has gotten better in the years that I've been doing this, but there are still scenarios. I still see clients that sadly by the time they get to me, they just didn't know that referral was an option. And I personally don't know how to fix that other than doing the outreach that I already do.
Right. And that's why we're doing this, because we're trying to educate them. You know, Deborah, she went through the same thing, you know, where it was just not to her fault. It was just misdiagnosed and misdiagnosed and misdiagnosed to the point where, you know, poor Noodle was in so much constant pain that it went so too far. And, you know, so it's very scary. And that's why we try to do these webinars, try to have our website out there so that people can look and see, okay. And the biggest thing is, just like you said on your slide, you don't need a referral. You can be your pet's advocate. And if something in your gut says, you know, I remember something, like I had one of the guys in our group, he said, I saw an article about 6 years ago in a magazine. Well, that was about my dog. And I was like, oh my God, it works. At least one dog we saved because he read that magazine and saw that, you know, I was out of town and the University of Georgia is where I went. And my vet, thank God, at 3 a.m. said, put your big girl pants on.
Just go.
Just go. Get your dog and called the University of Georgia. And by the time I drove there, they were waiting with the gurney and wheeled him in.
So we have an emergency service that's open 24 hours. Today, it's Veterans Day. So today was actually a holiday for UF. And so the hospital was open only for emergency. So I've been home because I'm on call and my phone just went off because my resident texted me. She just got called by the ER because they have a down dog. And so my resident has just gone in to go look at something. So we may be in surgery later tonight. I don't know what's going to happen. We're going to see.
Prayers for that dog, because we've been through it and we know how disheartening it is.
Most big specialty hospitals, most emergency clinics handle this honestly really regularly. The nice part is we go in, we examine the dog, and depending upon the dog's exam, we can say, we need to take your dog to imaging and surgery now, or this can wait till 8 a.m. when everybody's had a good night's sleep. And that's dependent upon the exam. So if this dog can actually still move its legs, or if it can get its bum up off the ground and take a few steps, you're good. You can probably wait till the morning, versus if you're truly paralyzed, you should not wait until the morning because that's really an emergency. And the big thing, the big takeaway is if you are down, regardless of where you are, if you are down, you really should go see a specialist. And then the specialist will be able to tell you much better what we should do in that individual case.
So here's what we do. Oh, go ahead.
Our biggest concern is the dogs that have these very severe, catastrophic, you know, the dog down type of situation. The situation that Teresa mentioned earlier with Doodle, he actually had a herniation at the lumbosacral joint. So he remained fully ambulatory, and he had pain that, because he also had hip dysplasia, it was attributed to the dysplasia, and therefore the diagnosis got missed until it was so bad that he was biting. And by the time that surgery was done, it became apparent that the spinal cord damage had been done, and he had some ongoing issues even after the surgery. So we ended up putting him down. But it's one of those things that, because it's a little harder to diagnose and it's not so catastrophic, I wonder how often you see that type of thing.
So at that level, at the LS, it's a bit different. One, because they're still walking. And two, the LS disease is almost falls into a bit of a different category. Usually those are a bit more chronic. I've seen a few that are acute in dachshunds, actually, and Frenchies. They present a bit differently. They come in often still walking, but they often can't move their tail. They often are fecally and urinary incontinent, so dribbling urine, dribbling poop, frankly, and extremely painful. But when you're back at that level, you're affecting nerves and not spinal cord. The other hard part is that in most mid-sized to large breed dogs, by the time they're middle-aged, a significant proportion of them have abnormal discs at the LS. And so that's where it gets hard, because is the abnormal LS actually a problem or not? And it can be clinically really tough to discern. And usually I end up talking to the surgeons, and the surgeons are like, yeah, it's just not the hips. And like, it becomes almost more of experience and gut feeling. And some of those dogs, we end up imaging them. We end up doing a CT or an MRI just because we're honestly not sure. And if treatment for one isn't working, you have to go after the other.
So for people that might be watching, if they're, maybe the dog's walking fine, but if they're seeing some incontinence and pain in that rear area, it's a potential issue that they might want to look into.
Yes. Yeah. And in that scenario, again, if it's pain that isn't responding to drugs, even that is a reason to actually seek a referral. Because regardless, like, even if you can still move, if you're in that much pain, we really should still fix that. We should try.
So this is where I do my little PSA. Definitely pet insurance helps pay for the high cost, but the majority of pet insurance out there right now is a reimbursed base. So I encourage everyone to have something like Care Credit or a credit card or a savings account so that you can at least walk in the door at a university or a specialist office, because unfortunately, many of them will require $2,000 to $5,000 upfront just to walk in, get the exam, and get the CT or the MRI done. So we've had to unfortunately do a lot of fundraisers, and the Boykin Nation is phenomenal at giving and helping, because we love these dogs. This breed it's just a wonderful breed. I've had different dogs before, and to me, there's nothing like them. But I really encourage everyone to understand that not just IVDD, you know, they're known as destroykins. They swallow things left and right. You know, there's unfortunately, there's canine cancer and, you know, in dogs and in cats, but, you know, just be prepared, be a prepared owner, be your dog's best advocate. If you want that dog around and you can see them through these types of things, you can see that if you get them there in time, the surgery and therapy, you can have your dog back and that love and that unconditional love, but you need to have the resources available. First and foremost, be your dog's advocate. Like she said, you have a right to go to a specialist if you want to go to a specialist, but you need to know that you've got to be financially prepared to go in there and handle that. So please.
Most hospitals and universities will require anywhere from 50 to 100% of the estimates. Sometimes it's the low end. Sometimes it's, you know, the low end of the estimate that they require. Sometimes it's 75% of the high end. It's really variable. Most places accept Care Credit, but not all do. And having dealt with pet insurance across the country, pet insurance is great. Just go for one of the bigger companies. There are a couple of them. I don't support any one or the other. If I were not a veterinarian, I would have pet insurance. I recommend all my friends get pet insurance for their pets, because if you have a Labrador, it's going to eat something stupid. You never know, the 4th of July, it's going to get freaked out, run out, get hit by a car. Pet insurance honestly is great, but you are correct. It will almost always reimburse you. So you are still responsible for putting a deposit down.
Right. So let's see. Everybody's saying thank you. They're watching this. Somebody's asking about having 2 copies of the gene.
That's stuff we just don't know.
We just did our webinar in September was with Paw Print Genetics, and they talked about it, and they said the same thing. It's still very, very new. And just so people understand, we still have that webinar up, and it's now on our website and on our YouTube site. But he also explained the same thing. If, you know, our dogs look a certain way, and we like the size and the look of our dogs. And Boykins in particular are a very small gene pool still, very small gene pool. So if we start, you know, pulling really good dogs out, we're going to lose that diversity and bottleneck it. And we may cause other issues trying to breed this out. So I know that, you know, it's still new, and I don't want anybody to panic. This is not about panicking. This webinar was just to bring you to light about, we are seeing injuries now with the Boykins. As she said, other breeds have it. So this is not just particular to the Boykins. I know Clumbers are having the issue too now.
Yep, well, I've been seeing Clumbers for years, not frequently.
Yeah.
But I've done spinal surgery on a number of them. I would
Right.
recommend, I don't know what your experience is, but the Canine Health Foundation, CHF, and oh God, I'm blanking on the name of the large group. The Canine Health Foundation does they have a number of breed specific things within them. They get money together for grants that they put out grant competitions for researchers that people, if there's a particular interest in something. So there are a couple of big not veterinary specific organizations, but organizations that are dog and breed associated that get funds together and organize a number of these things. And so that might be something that you guys potentially want to look into, reach out to.
Definitely, because I know that the Boykin Spaniel Society has already enlisted the help of Dr. Banash and Dr. Malone at UC Davis, but it was much more on the genetic side.
Correct.
So I think now the next step is to try and find the metadata that goes along with that to try and find out what's causing the injury, because, you know, realistically, an owner doesn't care whether their dog has the gene or not. What they care about is if they have a $10,000 devastating injury to their dog.
Yeah, and the first place to start, truthfully, with that would be something as simple as demographics. And so, you know, you could have probably a neurologist, honestly, to get it together. And you could do something as simple as a survey that goes out to neurologists and surgeons across the country, and you find out what's the incidence of this in Boykins across this country, because we have that data in our medical record system. And so it's as simple as having somebody search the medical records. And that's probably where you guys need to start, because that information from a genetic perspective, knowing how commonly this happens with the incidence of the gene is really important. That's stuff that the geneticists will actually want.
Fantastic. Well, I don't know if I see any other.
Boykin Bob had asked about a kennel rate for insurance.
I don't know if she can answer that or not, but
I have no idea.
Yeah, she's the surgeon.
Yeah.
She's the surgeon, but we definitely could. We could definitely look at doing a webinar with a couple insurance companies and see if they would have that.
And they do multi-dog discounts, correct?
I think a lot of them do.
Yes, I know Pets Best does for sure. So Gina says every Boykin owner should have the closest vet ER in facility with a neurologist on speed dial. And that's just so you know, the one website that you mentioned, the vet specialist, we have that on our website. I will be adding the other one, the acvs.org, to our website. So thank you for that. We've listed on our website from our group that people we know that have used certain facilities and have been very happy with them. We're not recommending them other than they've been there and they've been happy with them. So we put them on our page with the link, but we do have that search for where you can go, because if there's not one nearby, you can look there on that search engine and see if you can find somebody. But definitely a neurologist is what you need when this happens, because this is important. And, you know, not every vet seems to really understand the urgency. So it's up to you as the pet owner to understand the urgency and save your dog's life, if at all possible, if you want your buddy with you.
And the good news in all of this is that this is something that to a neurologist, this is bread and butter. To me, this is common. To me, this is everyday. To me, this is routine. As scary as that is for you, and having personally been on the really scary side of human medicine, when somebody tells you that this is common, that's actually a good thing, because that means there are protocols, there are routines, there are procedures for this. This is something that we do all the time, and that you want that comfort. You want to know that that's the case.
Doc, do we have a request to repeat the database name and whether anybody can access it?
Oh, no, it's not something that that's publicly accessible. So there are medical records that every hospital keeps. Every medical record system is different. But basically, like if somebody wanted to I'm doing a research study with some other people that we're doing a multi-institutional study. So I can reach out to someone I know at that institution and say, hey, can you search for X, Y, and Z? Because we're looking for this data. We're going to put it all together and then publish it. It's not a database that is publicly searchable.
Okay.
But it's something that if this is something that you guys have an interest in, you could talk a neurologist into starting with this and probably getting in touch with the geneticists at Davis, because they're eventually going to want that data.
Most definitely. Most definitely. And I think, like I said, this is early enough that, we're hoping that we don't see 20 years of this, that we try and help everybody out and figure out what it is before it becomes like hip dysplasia in the labs, that it's not that common.
Yeah.
So do we have any other questions, Deb? Everybody's saying thank you,
Us
thank you,
getting
thank you,
more,
thank
we
you.
have several thank yous. And we thank everybody for participating today. And the more that we can just educate people, the better off it'll be for both the dogs and for the owners.
And Doctor, I cannot thank you enough for accepting our call and offering. And I definitely want to thank Dr. Swift at U of F, because he's the one that connected us. He's done heart clinics for us here in Florida at our Boykin Fun Days before, and become a very good friend of ours. And when I reached out to him and said, hey, do you think you have a neurologist that might be interested in talking to us? He said, absolutely. And so grateful for that. And thank you for your time. And I know you may have to run now and go save a dog.
Yes.
Gotta go
Thank you
check the
very much,
emergency. Thank you very much. Good night, guys.
Good night. Thank you so much.
Good night, all.
Okay, I think it stopped.